Welcome, everyone. This lesson will explore immunity and inflammation, two of the body's most important defense mechanisms. As nurses, you'll care for patients with infections, autoimmune diseases, allergies like anaphylaxis, cancer, and inflammatory conditions every day. To understand why these conditions occur and how our treatments work, you first need to understand how the immune system recognizes threats, mounts a response, and restores balance. By the end of this lesson, you'll be able to connect the science behind immunity to real life clinical situations you'll encounter in practice and something that you'll be able to understand for NCLEX. By the end of this lesson, you should be able to explain the differences between immunity and inflammation, describe how the body's defense systems protect against diseases, and distinguish between innate and adaptive immunity. We'll also compare T cell and B cell immunity, explain how antibodies work, identify the major white blood cells and their function, recognize common immune disorders, and apply the nursing process to care for patients with inflammatory and immune-related conditions. These concepts provide the foundation for understanding many diseases you'll encounter in clinical practice. Before we dive into details, let's look at the big picture. The body has two major defense systems. The first is inflammation, which acts like the first responders arriving at the emergency. It's fast, non-specific, and begins immediately after an injury or infection to contain the damage. It removes harmful pathogens and it starts the healing process. The second is the immune response, which is like special forces. It takes longer to activate, but targets a specific pathogen, destroys it, creates immune memory, and helps protect the body from future infections. Together, these two systems work as a team to keep us healthy. So remember, inflammation is the first responders. Immune system is the special forces. So why is this important? Because nearly every disease you'll study in nursing involves inflammation and the immune response, or maybe both. You need to understand it. So an example would be pneumonia, because that causes inflammation while the immune system fights the infection. Asthma is driven by inflammation of the airways. In lupus, the immune system mistakenly attacks the body's own tissue. So that's like an autoimmune disorder. Crohn's disease involves chronic inflammation of the GI tract. Organ transplants require medications to prevent the immune system from rejecting the new organ. Our body is trying to do a good job, but then it doesn't realize that this new transplant is something that we need. So we need to give medication to suppress that. When it comes to cancer, the immune system may fail to recognize and destroy the abnormal cells. Understanding these processes help you understand the disease, the symptoms, and why specific treatments work. So the body's first line of defense is made up of physical and chemical barriers that work to keep pathogens from entering the body in the first place. Think of it as a security fence around the building. The skin forms a protective barrier. Mucous membranes trap germs. Stomach acid destroys many microbes that are swallowed, and normal flora or beneficial bacteria complete the harmful organisms to prevent them from growth. Major histocompatibility complex, also known as MHC, proteins help the immune system recognize which cells belong to the body. If these first line defenses are effective, many infections are stopped before the immune system ever needs to respond. But in this picture, once the skin barrier is broken, it can lead to going into the system. Our first line of defense is our skin. Once it is broken, there's an increased risk of infection. Our body automatically has streptococcus or staph as our normal flora. If we let it get inside our skin cells, if we let it get inside our cells, it causes a problem. If germs make it past the body's first line of defense, the second line of defense is activated. This includes white blood cells, which quickly identify and attack anything that doesn't belong. Neutrophils are the first cells to arrive and destroy bacteria. Macrophages engulf pathogens and clean up damaged tissue. Basophils release histamine to trigger inflammation, while eosinophils help fight parasites and are active during allergic reactions. Lymphocytes, including T cells and B cells, provide the body's target immune response. Together, these cells work to eliminate pathogens and protect the body from infection. The third line of defense is the inflammatory response. Inflammation is the body's rapid, nonspecific reaction to tissue injury or infection. When cells are damaged, they release chemical mediators such as histamine or cytokines. These chemicals increase blood flow, make blood vessels more permeable, and attract white blood cells to the injured area. The goal is to contain the injury or destroy the pathogens or remove damaged tissue and begin the healing process. Although inflammation is protective, an excessive or prolonged inflammatory response can also damage healthy tissues. The fourth line of defense is the adaptive or specific immune response. Unlike the earlier defenses, this system targets one specific pathogen. B cells produce antibodies that bind to the invader, while T cells destroy infected or abnormal cells and help coordinate the immune response. Another important feature is the formation of memory cells. These cells remember the pathogen, so if you get exposed to it again, your immune system responds much faster and more effectively. This long-term protection is the reason why vaccines work. This is why we give MMR vaccines for measles, mumps, rubella. Your body creates memory B and T cells. Years later, if you're exposed to measles, your immune system recognizes it immediately and mounts a rapid response, often preventing you from becoming sick again. One way to remember the body's barrier defenses is to think of them as defenses of a castle. The skin is the strong outer wall that keeps invaders out. Mucous membranes act like sticky traps catching germs before they enter deeper tissues. Tiny cilia work like escalators, sweeping mucus and trap pathogens out of the airway. Sometimes we cough it up or we actually swallow it. And if we swallow it, it goes into our stomach acids. Stomach acid is like an acid-filled moat that destroys many microbes you swallow. Normal flora are the friendly guards that compete with harmful bacteria. And MHC proteins, are like ID badges that help the immune system recognize which cells belong to the body and which do not. Together, these barriers stop many infections before they even begin. Right? So what triggers inflammation? Inflammation begins whenever the body detects tissue damage or a potential threat. Think of it as the body's emergency alarm system. The trigger can be physical injuries such as trauma, burns, or cuts where tissues are directly damaged. It can also be caused by infectious organisms, including viruses and bacteria that invade the body. Toxins, whether from chemicals, medications, or venom, can injure cells and trigger inflammation as well. In some cases, the body reacts to allergens such as pollen or peanuts, even though they are not actually harmful, leading to an inflammatory response. Foreign bodies like a splinter or a surgical suture can also activate inflammation because the body recognizes them as something that doesn't belong. No matter what the trigger is, the goal of inflammation is always the same: to contain the injury, eliminate the harmful agent, remove damaged tissue, and begin the healing process. So many people think inflammation is bad, but inflammation is actually a normal and protective response. Its purpose is to remove damaged and dead cells, destroy invading pathogens like bacteria and viruses, prevent the infection from spreading, and begin the healing process. Inflammation in the body is the body's way of cleaning up the injury and preparing the tissue for repair. While excessive or chronic inflammation can become harmful, acute inflammation is essential for recovery. Without inflammation, wounds would not heal properly, and infections would be much harder for the body to control. Inflammation occurs in three major stages. Stage 1 begins with tissue if it's injured. Damaged cells release chemical messengers such as histamine, bradykinin, prostaglandins, and leukotrienes. These chemicals act like emergency signals, alerting the body to help what is needed. In stage 2, it involves changes in the blood vessels. The blood vessels dilate, allowing more blood, oxygen, and nutrients to reach the injured area. They also become more permeable or leaky, so white blood cells can leave the bloodstream to enter the damaged tissue. This is why the area becomes red, warm, swollen, and painful. With stage 3, it's the cleanup and repair phase. Neutrophils arrive first to destroy the pathogens, followed by macrophages, which remove dead cells and debris. Platelets help stop bleeding and support tissue repair. Once the damaged tissue is cleaned up and the infection is controlled, the healing process begins. So the four cardinal signs of inflammation is redness, heat, swelling, pain, and sometimes we add loss of function. Why redness? Because there's an increase in blood flow. Why is there heat? Because there's an increase in blood flow as well. The swelling happens because there's fluid that leaks into the tissues when we was letting the WBCs in. Pain happens because these are one of the things that histamine and bradykinin stimulates in the nerves. So when inflammation occurs, you'll often see these four cardinal signs. Some healthcare providers also say that the fifth is loss of function, but why do these signs happen? Redness and heat occurs because of the blood vessels, they dilate, bringing more blood and oxygen, right? So when you talk about histamine and bradykinin, which stimulates nearby nerve endings, and the swelling places additional pressure on those nerves, if the inflammation is severe, the pain and the swelling can temporarily cause a loss of function, making it difficult to move or use the affected body part. These signs are evidence that the body is aching, working to heal itself. Sometimes, if you feel like there's a pain in your body and you know you didn't do anything, pain is like one of the first signals that your body does. So, once you have pain, you need to listen to it. Where's the location? Is it referred pain? What is it related to? If your patients report that, you have to be more in depth with your assessment. Inflammation can be acute, subacute, or chronic, depending on how long it lasts. Acute inflammation develops quickly and typically lasts minutes to a few days. Its goal is to eliminate the cause of injury and begin healing. Neutrophils are the main white blood cells involved. Common examples include a cut, sprained ankle, or pneumonia. You'll often see the classical signs of inflammation: redness, heat, swelling, and pain. Regardless of where the injury occurs, the body's inflammatory response follows the same basic process. Subacute inflammation is the transition phase, lasting from about 2 to 6 weeks. During this time, the initial inflammation decreases while tissue repair and healing continue. Chronic inflammation lasts months to years and occurs when the trigger isn't eliminated and when the immune system continues attacking the healthy tissues. Macrophages and lymphocytes become the dominant cells, and over time, fibrosis or scar tissue can develop, leading to permanent tissue damage. Common examples include rheumatoid arthritis, right? Crohn's disease, lupus, and COPD. The key difference is that acute inflammation heals, while chronic inflammation can cause ongoing tissue damage. Each type of white blood cells has a specific job in protecting the body. Neutrophils are the first responders. Think N, neutrophils, now. They arrive within minutes, perform phagocytosis by engulfing the bacteria and release substances like pyrogens that help produce fever. Macrophages are the body's big eaters. They clean up dead cells and debris after the initial response, and they often present antigens to T cells, helping activate the adaptive immune system. Basophils and mast cells are responsible for releasing histamine, which causes blood vessels to dilate and become more permeable during inflammation. Mast cells are important to understand, especially for asthma. Mast cells are found in the skin, respiratory tract, and GI tract, making them especially important for allergic reactions. Finally, eosinophils specialize in fighting parasites and are often elevated during allergic conditions, such as asthma and eczema, hence the reason why asthma and eczema are pretty much hand in hand. Remember, neutrophils fight bacteria first, macrophages clean up, basophils and mast cells release histamine, and eosinophils fight parasites and allergies. A fever is a normal and beneficial part of our body's immune response. When white blood cells detect an infection, they release chemicals called pyrogens. These pyrogens travel to the hypothalamus, the body's thermostat, and reset it to a higher temperature. As a result, the body generates and conserves heat, causing a fever. But why is this helpful? A higher body temperature involves the function of white blood cells, slows the growth of many bacteria and viruses, and speeds up important immune and chemical reactions that help fight infection. While while having high fevers or fevers in certain patients require treatment, a mild to moderate fever is often a protective response rather than something harmful. This is why we don't always rush to lower every fever with antipyretics. We consider the patient's overall condition first. That is especially important when it comes to children. If your child is running around with a fever, they are just healing with something. It could be that they're teething. But if they start to have malaise and they can't move around or they become a little bit more disoriented, that's when it's more of a concern. Leukotrienes are chemical mediators of inflammation produced mainly by white blood cells. They help coordinate the body's response to injury and infection. During inflammation, leukotrienes contribute to symptoms such as malaise, which is the feeling of being tired or unwell, encouraging the body to rest. They can also cause myalgia or muscle aches and arthralgia or joint pain. While these symptoms may seem unpleasant, they serve as an important purpose. They encourage us to reduce our activity and conserve energy so the body can focus on fighting infection and healing. Leukotrienes are also important in conditions like asthma, where they promote bronchoconstriction, produce mucus production, and airway inflammation. This is why medications such as montelukast, also known as Singulair, work by blocking leukotrienes to improve asthma control. So think leukotrienes, lungs, and lethargy. Lungs cause bronchoconstriction and mucus production in asthma. Lethargy contributes to malaise, muscle aches, and joint pain, helping the body conserve energy during illness. Okay, so now that we've discussed the body's general inflammatory response, let's focus on one of the most important groups of the white blood cells, lymphocytes. All lymphocytes begin as stem cells in the bone marrow, but they develop in three different types with unique roles. B cells mature in the bone marrow and produce antibodies. T cells leave the bone marrow and mature in the thymus, where they learn to recognize and respond to specific threats. Natural killer or NK cells are part of the innate immune system and provide rapid protection by destroying virus, infected, and abnormal cells. When you understand this, you'll be able to form the foundation of the adaptive immune response and are frequently a question that they usually ask in the NCLEX. So natural killer cells and lymphocytes, activated killer cells, are aggressive against neoplastic cancer cells and promote rapid cellular death. They do not seem to be programmed for specific identification of cells. Research on lymphocytes are ongoing. There may be roles that have not been identified when it comes to these kind of T cells. So T cells are the immune system's attack cells. When they recognize a foreign invader, they release chemical messengers called cytokines. These cytokines help destroy infected or abnormal cells directly and also signal other immune cells. Phagocytosis happens to come to the area to strengthen the inflammatory response. T cells recognize these threats because of the foreign cells. They display different surface antigens and do not match the person's own major histocompatibility complex, or MHC. These differences tell the immune system that this is not self, this is not us, and should be eliminated. The adaptive immune system has two main parts, T cells and B cells. T cells provide cell-mediated immunity, meaning they fight infected or abnormal cells directly. Helper T cells, CD4, are like the team's coaches. They release chemical signals called cytokines that activate other immune cells, including the B cells. Cytotoxic T cells, which is CD8, are the soldiers that kill virus infected cells, cancer cells, and transplanted cells. So memory T cells stay behind so the body can respond much faster for the next time, right? Once the infection is under control, regulatory or suppressor T cells help show the immune response to prevent unnecessary damage to healthy tissues. B cells provide humoral immunity. Humoral immunity is the part of the immune system that uses antibodies that fight germs in body fluids. So remember, B cells, body fluids, such as blood and lymph. When a B cell recognizes a specific antigen, it becomes a plasma cell and produces antibodies. These antibodies attach to the antigen like a lock and key, marking it for destruction. The antibody-antigen complex also activates the complement system, a group of proteins that help destroy pathogens and make it easy for white blood cells to remove them. So when it comes to the adaptive cells, it is super helpful. T cells destroy infected cells while B cells make antibodies to fight pathogens and provide long-term protection. So let's walk through the antibody response step by step. First, an antigen, such as chickenpox, enters the body. A B cell that recognizes the specific antigen becomes activated, often with help from a helper T cell. The activated B cell then changes into a plasma cell that acts like an antibody factory. Plasma cells produce antibodies, also called immunoglobulins, that circulate through the blood and body fluids. These antibodies bind specifically to the antigen, forming an antigen-antibody complex, much like a lock and key. This complex activates the complement system, a group of proteins already circulating in the body. The complement proteins attach to the pathogen, punch holes into it, especially into their outer membrane, and attract additional white blood cells to help destroy it. So an example would be chickenpox. Antibodies attach to the virus, complement help the damage and eliminate it, and the immune cells remove the remaining debris. At the same time, memory B cells are formed, allowing the body to recognize the virus quickly if you're exposed to it again. This is the basis of long-term immunity and how vaccines protect us. Antigen enters, B cell recognizes, plasma cell forms, antibodies are produced, antigen antibody complex, complement is activated, pathogen is destroyed, memory cells are remained. This sequence will help you remember the entire antibody response from start to finish. Now, let's look at the 5 major immunoglobulins or antibodies. IgM is the first antibody produced during a new infection. IgG is the most abundant antibody in the blood and provides long-term immunity. It can also cross the placenta to protect a developing fetus. A great example is chickenpox. After infection, IgG protects you from getting chickenpox again, but the varicella zoster virus can hide dormant inside our nerve cells in the nervous system. This one is very smart and tricky. Because antibodies have limited access to the neurons due to the blood-brain barrier, the virus can later reactivate as shingles. So if immunity declines, you could get shingles because you had a history of chickenpox. IgA protects the body surfaces like the mouth, lungs, guts, tears, saliva, mucus, and breast milk. IgE is involved in allergies, asthma, and fighting parasites. So just remember, IgE, it helps with asthma and allergies. Finally, IgD helps activate B cells to begin the antibody response. So let's connect this asthma IgE. So when it comes to asthma, IgE is the antibody responsible for allergic reactions. When a person with allergic asthma breathes in the allergen, like pollen, dust, mites, or pet dander, IgE recognizes it and binds to mast cells. This triggers the release of histamine and leukotrienes, which cause the airways to become more inflamed, produces more mucus, and tighten through bronchoconstriction. That's why patients experience wheezing, coughing, chest tightness, and shortness of breath. This is also why asthma medications often include antihistamines, leukotriene inhibitors, and inhaled corticosteroids to reduce the immune response. Now, let's look at two important communication molecules of immune system, interferons and interleukins. Think of them as the body's text messaging system. Immune cells don't work alone. They constantly send chemical signals to coordinate and attack. Interferons mainly help fight viral infections by warning nearby cells and slowing viral replication. Interleukins act as messengers between white blood cells. So inter white blood cells. They help activate, grow, and direct the immune response. Understanding these signal molecules help explain how the immune system organizes a fast, coordinated defense against the infections. Tumor necrosis factor is one of the body's most powerful inflammatory cytokines. It is released mainly by macrophages when they detect infection or tissue injury. So tissue necrosis factor, also known as TNF, acts like an emergency alarm. It tells blood vessels to become leaky so white blood cells can reach the injured area, and it helps trigger fever, inflammation, and the act phase response. While TNF is essential for fighting infections, too much TNF can damage healthy tissue. That's why diseases like rheumatoid arthritis, Crohn's disease, and psoriasis are often treated with tumor necrosis factor inhibitors, which reduce excessive inflammation while preserving as much normal immune function as possible. So let's connect inflammation with the immune response. When tissue is injured, the Hageman factor, also called factor 12, is activated. Think of it as the body's emergency switch. Once turned on, it starts several protective systems, including the kinin system, which produces bradykinin, a chemical that causes pain and increases blood vessel permeability. At the same time, mast cells and basophils release histamine. Histamine causes the blood vessels to dilate and become leaky, letting white blood cells, antibodies, and plasma proteins to leave the bloodstream and enter the injured tissue. This is how inflammation and immunity work together. Inflammation opens the door, and the immune system sends its soldiers in, neutrophils, macrophages, and later lymphocytes to destroy the pathogen. They clean up the damaged tissue and begin healing. Without these chemical signals, immune cells would never know where to go. Now let's compare the body's two immune systems. Innate immunity is a defense you're born with. It responds immediately. It's non-specific and has no memory. It includes inflammation, neutrophils, macrophages, and other first responders that attack any invader. We were already with them. We originated with them. Now, adaptive immunity develops after exposure to a specific pathogen and through vaccination. It takes longer the first time because B cells and T cells must recognize the invader. B cells produce antibodies, while T cells coordinate and destroy infected cells. The key advantage is memory. The next time the same pathogen enters the body, the adaptive immune system responds much faster and more effectively, often preventing illness altogether. All right, so congratulations. You now have the foundation of immunology. Rather than memorizing hundreds of diseases individually, think about the underlying immune process. Ask yourself, is this immune system overreacting, underreacting, attacking the body's own tissues, reacting to something foreign, or failing to recognize abnormal cells? Once you understand these core concepts, diseases like lupus, asthma, HIV/AIDS, transplant rejection, and cancer become much easier to understand. From this point forward, you'll simply apply the same immune principles to different disease processes throughout nursing school and clinical practice. So here is our final takeaway. The immune system is a coordinated team. Barrier defenses keep pathogens out. Inflammation responds immediately to injury. Innate immune cells attack quickly, and adaptive immunity creates targeted antibodies and memory cells that provide long-term protection. Understanding these sequences make it much easier to understand the disease. As nurses, you need to understand which line of defense is working, which immune cells or mediators are involved, is the response protective, excessive, or deficient? So master the normal immune response first. Once you understand how the immune system normally protects the body, recognizing the patho, signs and symptoms, medications, and nursing interventions for immune-related diseases becomes much easier. I really hope this helps. Take advantage of this. And when you go to different disease processes, try to incorporate it to the inflammatory. Which part of the inflammatory response, which part of the immune response is being affected at this time? Thank you so much for listening.